name is Angie Long, and I'm here today to do a head-to-toe health assessment on my patient Jack. We met previously in an office to discuss his health history, his medications, his allergies, and his overall health status. I asked him to move into this exam room, which gave me the opportunity to make some general assessments about Jack. He is alert and oriented. He is age appropriate in his conversation. He makes good eye contact. His gait is steady with even, smooth strides. He is well dressed and age appropriate and season appropriate. We were able to do some vital signs before we came in here. His apical pulse rate was 78. His blood pressure was 132/88. His respirations were 18. His temperature was 97.9 measured orally, and he denies any acute or chronic pain problems. His height is 5'10". His weight is 225 pounds. That puts his BMI at about 33.7. I'd like to start the head-to-toe assessment with just examining your head. Just feeling for any lumps or bumps. Jack explains to me that he works outside for his job, and we've discussed as one of his health promotion points the importance of putting sunscreen on top of his exposed body parts, his head, his arms, his face, and if not, to also to cover those body parts as well. So that was part of our health promotion.
One more.
So again, we just were looking for any lumps, bumps, or lesions to his head. And we're going to go ahead and just look at your sinuses, and you should feel pressure, but no pain. Great. His facial features are proportionate and seem appropriate for his face. Now, at this time, Jack, I'm going to ask you to help me out with a couple of things. I'd like for you to take this card and place it over your right eye. And I'm going to place one over my eye and bring my finger into your periphery. And when you see my finger, I'd like for you to say now.
Now. Now. Now. Now.
Okay, great. Now if you'll swap, and we'll do the same test again using the other eye.
Now. 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 Now.
Okay, thank you. Now, using only your eyes, I'd like for you to follow my finger. I'm going to shine a light into your eyes, and if you'll just look straight ahead and try not to blink. Great. Sorry, no, that's bright. Now, if you'll just look up for me. I'm just looking at the conjunctiva, and it's pink and moist. The sclera are white. His pupils are about 5 millimeters, and they are round and reactive to light. At this point, Jack, I would like to just inspect your eyebrows, your eyelids, your eyelashes. They all seem to be, the hair on his eyebrows and his eyelashes seem to be dispersed evenly. At this point, I'd like to look at your mouth. Before we get to your mouth, I'd like to do your nose. Just looking at your nose. And I'm going to ask you, I'm going to close one side and just blow out the other side. Okay? And the other side. Okay? And no lesions, lumps, or bumps on his nose. Now, I'd like to look at your mouth. Can you open your mouth for me? And your tongue is already out. Can you raise your tongue up so I can see the bottom? Great. And I'm just going to shine a light in there and look at your teeth. No broken teeth. Looking at the palate. Now I'm going to place this tongue depressor into your mouth. And say ah.
Ah.
His uvula is midline, and he does not have any tonsils right now. Now, at this point, I'd like to look at your ears. And again, just checking your ears for any lesions that you might have. And your ears are sensitive to sun as well. That'd be a great place to put your sunscreen. And I don't see anything. Now, we deferred the otoscope exam at this time, but I would expect to see that each of his eardrums would be a pearly gray translucent color. Now at this point we're going to do a whisper test, and I'm going to whisper a series of words, and I'd like for you to repeat what you hear. You ready?
Summer. Beach. Ball.
And I'm going to move to this side and do the same.
Ocean. Fish. Flower.
Great. Now, I'm just going to take a feel to your neck and feel your lymph nodes. The trachea is midline. Just looking at the symmetry. Now, can you turn your head from side to side? Okay, and touch your chin to your chest. Excellent. Okay, now I'm going to go around. And I'm going to untie your gown. Maybe. Pull that down for me. And just looking at the symmetry of his shoulders. And you're going to feel my hands on your back. And if you could, take a deep breath. And again. Okay, you can just relax. I'm going to be percussing. And I'm going to listen. So if you could take some just normal breaths. Around to the front. I'm going to pull the gown down just a little more. I'd like to do the same thing on the front. And if you could take a deep breath in. Okay, and again. Great, you can breathe normal. Just going to listen. I'd like for you to lean forward, inhale and exhale, then hold it. Okay, you can breathe. Now, if I can get you to, we'll leave this down, but if I could get you to swing your legs up on the bed. I'm just going to feel, looking for the apical pulse. I would expect it to be mid-clavicular, the 4th or 5th intercostal space. And I'm just going to take a listen. chest, just the rise and fall of your chest. Okay. No scars on his abdomen noted. Now I'd just like to listen to your stomach, your abdomen. Normal bowel sounds and no vascular sounds. Just kind of feel lightly. And just a little deeper. Perfect. I'll let you put your arms back through. And I'm going to make sure that your gown is down and come down to your feet. Looking for any edema. And none noted. Check the pulses in the tops of your feet. So DP and PT pulses are about a 3+. Now while you're in the supine position, I'd like for you to take the heel of this foot and run it down the shin of your right leg. Okay? And then if you could do the opposite with this foot. Perfect. All right, I'll let you swing your legs out to the side. One of our other health promotions that we talked about is that Jack is a diabetic, and we talked about the importance of making sure that he checks his blood sugar regularly and also inspects his feet for any cracks or sores or blisters to make sure that he's keeping in touch with his diabetes as far as it affects his feet. Now just for the tail end of this exam, I'm going to ask you to do a couple of things for me. I'd like for you to extend your arms. And if you could close your eyes and touch your index finger of each hand to your nose. Okay, you can put your hands down. Now, with your eyes still closed, I'm going to take a Q-tip and touch different portions of your body. And I'd like for you to say now when you feel it. Checking your skin turgor and your capillary refills. Okay, if you could place your hands on your knees, and now I'd like for you to flip-flop your hands as fast as you can. Okay, perfect. This concludes our health assessment today. Thank you so much, Jack, for being a part of this and being my patient, and thank you.